Hi, I'm Kayla. I'm going to show you how to suction today. So the first thing that you need to do is you need to monitor your patient to see if there's any indication to suction. Some of these indications can be if you hear coarse crackling in the trachea, if your patient has acute respiratory distress syndrome, if you see saw teeth-like patterns on the ventilator, and if your patient has a really low SpO2 or they just aren't oxygenating correctly. So after you decide that you do need to suction your patient, you need to gather the equipment. So the equipment needed is a vacuum regulator, the container, the tubes, the connection, and the suction catheter. After you gather the equipment, you need to check your patient's chart. You need to see how they've reacted before, what the patient, what has been suctioned from them before, and just the main reason why they are there. After that, you want to go in, you want to introduce yourself to the patient and tell them what you're going to be doing. For instance, Mr. Jones, hi, I'm Kayla. I'm a respiratory therapy student. I'm going to suction you today so that way we can get that junk in your lungs out and that way you can breathe better. After I tell my patient what I'm going to be doing, I'm going to go and wash my hands as well as put gloves on to make sure everything stays clean and sanitary. After that, you want to put your patient in a semi-Fowler's position. For this demonstration, I'm just going to leave the mannequin like this. After that, you want to make sure that your equipment is functioning correctly. You can do this by taking off the connecting tubing and putting your thumb over the hole. The suction pressure should be about -100 to -150 millimeters of mercury. A seasoned therapist can feel just by the amount of pressure on their thumb. So then you want to reconnect this and you want to monitor your patient. Then you need to look at heart rate, respiratory rate, SpO2, heart rate pattern, the respiratory pattern, and as well as intracranial pressure. After you monitor your patient, you want to go ahead and hyperoxygenate them. And you also want to make sure that the thumb port is on. So that way you can press it down. And then you're going to hyperoxygenate your patient. You can do this by manually ventilating them or pushing a button on the ventilator. So once your patient's SpO2 reaches about 99 to 100, that's when you know that you have hyperoxygenated enough, or go from more than 30 seconds to about a minute. After you hyperoxygenate, you can, if you see that your patient has really thick secretions, you can lavage with normal saline, or if there's an order from the doctor, you can do sodium bicarb. So after you hyperoxygenate your patient and you lavage, you want to make sure you tell the patient what you're going to do. For instance, Mr. Jones, all right, I'm going to go ahead and suction you now. It's going to make you forcefully cough, and it's going to be a big, big cough, all right? So after you tell the patient what you're going to be doing, you are going to then stabilize the airway and start suctioning. You want to do this by putting the suction catheter down until it hits some resistance. That resistance is the carina. So then you want to pull the suction catheter away about 1 centimeter, and that's whenever you start applying the suction. And you pull up continuously, you're intermittently pressing the thumb port, and you are continuously watching the monitor. And this whole thing should last about 10 to 15 seconds, all right? Make sure that you are watching the monitor while you are doing this, okay? So stabilize the airway, and let's put the suction catheter down while you are looking at the monitor. All right, some resistance. You want to pull up about 1 centimeter, apply suction, and twist. All right, so you've suctioned your patient. Now you want to make sure that you hyperoxygenate them again. You can do this by manually ventilating them or pressing the button on the ventilator. After your patient, you want to do this for about a minute. So after you do that, you want to monitor your patient again. Check heart rate, respiratory rate, SpO2, respiratory pattern, heart rate pattern, and intracranial pressure. After you monitor your patient and make sure everything's good, you want to auscultate. So auscultate bilaterally. So if you hear any crackles, then you should probably go ahead and suction again. But if everything sounds pretty clear, then you did your job. So if you decide that you're done, you want to go ahead, turn the thumb port off. If you see any secretions in the actual suction catheter, you can go ahead and lavage it through this port with normal saline. Then you want to, take off your gloves, wash your hands, and then the last thing that you need to do is go and tell the RN that you did suction the patient, as well as chart. You need to chart the color of the sputum, how much there was, and how the patient reacted to it. But after that, you're pretty much done. All right, that's how you suction.